Hi guys, welcome to dental classes. Today we shall move on with our MCQ discussion session. Today we shall discuss 10 questions from prevention of disease. We all know there are many levels to prevention of disease starting from primordial, then primary, secondary and tertiary. Now let's see certain important questions that has been repeatedly asked from these topics. Okay, let's move to the questions. First question. Secondary level of prevention includes all the following except. We know that in secondary level of prevention there is early diagnosis and prompt treatment. Let's see which all the options will come under it. Health screening for diabetes mellitus, case findings for falciparum malaria, contact tracing for STIs and reconstructive surgery in leprosy. These are the options. Now for people who are trying to do it as a test, you can pause the question and mark your answer. Now moving on to the answer. Here we see that first three options, that is screening, case finding as well as contact tracing, are all secondary levels of prevention, while reconstructive surgery in leprosy is actually a rehabilitative procedure to remove or reduce the deformities that has occurred because of leprosy. So it comes under tertiary prevention. So the answer is option D, reconstructive surgery in leprosy. Okay. Now moving on to the second question. Which of the following is primordial prevention? Let's see each option one by one. Action taken prior to the onset of disease. This is called primary prevention. Prevention of emergence of development of risk factors. So here the risk factors has not developed and you are trying to prevent the emergence of development of risk factors. And this is in fact what is primordial prevention. So the answer is option B. Now C option, that is action taken to remove the possibility that a disease will ever occur, will also come under primary prevention, and D option, that is action that halts the progress of a disease, that is actually secondary prevention. Okay. Now moving on to the third question. Disability limitation is a mode of intervention for. So this is a very direct question because whoever have read the topic knows that tertiary prevention has two areas, that is disability limitation and rehabilitation. So the answer is option D, tertiary prevention. Okay. Now moving on to the fourth question, that is screening of the diseases is which type of prevention? Screening of diseases comes under secondary prevention because it helps in early diagnosis and thereby prompt treatment of the disease. So screening comes under secondary prevention. Okay. You can also remember it by remembering that S and S, that is screening comes under secondary prevention, like that also you can remember. Okay. Now moving on to the fifth question, that is pap smear test for detection of carcinoma of cervix is which level of prevention? Again it is a screening procedure, so it is coming under C, secondary prevention. Okay. Now moving on to the sixth question, action which halts the progress of a disease at its incipient stage and prevents complications. That is, here the disease has already occurred, but you are trying to prevent the progression of that disease from the very early stage and prevent its complications. So this comes under prompt treatment or early diagnosis and prompt treatment, that comes under secondary prevention. Okay. Now let's move on to the next question, that is seventh one, that is iodine salt supplementation is. Here iodine salt supplementation is actually a specific protection because you are aiming at supplementing iodine. It is very specific purpose, no? So it is coming under specific protection of actually primary prevention. Okay. Now let's move on to the next question, that is desk provided with tabletop to prevent neck problems is an example of. You are providing desks with tabletop so as to prevent neck problems. So which type of prevention it will be? It will be coming under B, primary protection. Okay. You are trying to prevent the occurrence of disease, na? So it is coming under primary prevention. Okay. Now let's move on to the next question, that is ninth one. In an area with fluoride rich water, the defluoridation of water is which level of prevention? Here the fluoride is already present in the water and you are trying to defluoridate the water so as to prevent fluorosis. So it is actually specific protection. You are trying to defluoridate water. So it comes under what? It comes under primary prevention. Okay. So the answer is option A, primary. Now finally let's move on to the 10th question, that is primary prevention of dental caries includes. The options are A, fluoridation, B, dental health education, C, mass screening, and D, dental fitting, teeth extraction, etc. Here you know screening comes under secondary prevention, so it does not come under this option. Dental fitting, teeth extraction, and etc. are actually the disability limitation, secondary, tertiary, it's all treatment methods. Na? So when you go to first two options, that is fluoridation and dental health education, you can see that both can be considered as primary prevention of dental caries. So if you have an option to give multiple options, or if anywhere, so you can give both. But if there is a question like you have to give a single MCQ answer, it is more likely that the answer can be given as fluoridation. Okay, since fluoridation is better known to prevent dental caries, so the answer is option A and B. Okay, now that's all for today. Thank you. Hope you have liked my class. For more such lectures, please like, share and subscribe. Thank you.